Thank you for that introduction, and good afternoon or good morning, everyone. It is good to be here. So I'm going to spend the next 15 or so minutes sharing a little bit about what we do as an identity verification company, and then talking a bit about technology, health passports, and how it could potentially work. So we started the company, myself and my two co-founders, 8 years ago, and our focus has been around identity verification. We're now a team of just about 400 people, and historically our focus has always been around financial services. So if you are registering as an individual to an online bank, for example, the bank would be our customer, and they would essentially embed our technology into their apps, web app or smartphone app, so that as people are registering, they're asked to take a photo of their ID and a photo of their face. And then behind the scenes, we're using technology to ensure that that ID seems genuine and that person's face matches the photo on the ID. Now, where that could be relevant to a health passport or immunity passport is naturally, there are two parts to this program, a health passport program working. The first is an effective and robust testing mechanism that tests for antibodies, for instance, binding that to some sort of digital app, for example. That's one part of it. And then the second part is for that app to then be bound to the person in the physical world. And that's the role that we play. Naturally, we're not involved in any of the testing or anything beyond just binding that person's physical identity to this digital app, so that in essence, you can be sure that when the individual presents that to different organizations, that they are who they claim to be, and they haven't taken someone else's phone, whether it's a flatmate or a sibling or someone else, so that there's integrity in the system. Now, naturally, ahead of getting started, it goes without saying that we as a company are not impartial in this, and that should such a program happen, technology like ours is likely to be relevant. But having said that, we are involved from a tech perspective around what could be done and how technology could be used to mitigate the risks and essentially have the best of outcomes. So with that, just a couple of slides around what we focus on as a company, and then onto health passports. So as I mentioned, we anchor a person's digital account in a real identity. And the way that works is via their government ID and facial biometrics. So there are typically 3 steps. The first, as you can see on the left, is the user is asked to take a photo of their government ID, such as a driving license or passport. The second is typically a short selfie video, which includes some sort of randomized task, such as reading 3 randomly generated numbers. And that's how we know that the person is genuine and the owner of that identity, so that we are then able to bind that person's physical identity to this digital app. Now, onto health passports. So in short, a health passport is a presentable proof of immunity that returns a yes/no on a person's health status, but without them having to share any personal information. And this is the last component, which is crucial, because a recipient or a relying party, an organization that is looking to see whether you have potentially immunity or not, all they need to know is a yes/no on that status, the health status. They don't need to know any other personal information, such as your date of birth or your address or any other health records that you may have. And technology can play a big role in facilitating that. Now, the tests and the conditions that we have set and the models that we have seen succeed, essentially when it comes to the identity components, they have 4 conditions. The first is that they can operate at scale so that everyone has access to them. Second is that ultimately they are secure and robust, so that if an individual is registered and has access to an app, then they can't lend it to a sibling or a flatmate. Then whoever owns those certificates is the actual person who's presenting it at different occasions. Third is to make sure it's very convenient, so users are able to register and have a frictionless experience. And lastly, it's naturally crucial for it to be privacy-centric and respect all of the privacy rights in particular. So how could this work visually? As you could expect or imagine, should such a program be extended, there would be a setup process where an individual is asked to register, and that could be either at a physical location or at home with a camera phone, a smartphone device, or a web browser. The second is for there to be a mechanism to have them tested and bind those test results to the app, which is something that we don't focus on, but others, quite a few other companies do. And there's a panel straight after this where we're going to discuss that a little bit more. And then the third component becomes having an easy way to present that in different places. So that could be via a barcode system or a QR code system, essentially similar to how you would display a boarding pass on a train, for instance. There could be a simple mechanism that runs it in that way. And different countries and different organizations have tried and are trying different things. And you have authorities and governments on the one side running programs and pilots, and there are also private companies doing the same. So this famous, more recently, the World Health Organization commented on immunity passports or health passports with the factually correct statements of that there's not enough evidence to give people risk-free certificates, and that what we don't know yet is a level of protection or how long it lasts, which is very much the case. Now, given that we're pretty much 4 or so months into this pandemic, we already know with some strong evidence that those who've had it over the last 4 months don't seem to be getting it, at least within this 4-month period. But we won't know whether that immunity is going to last for 6 months, 12 months, or 18 months until that period of time has passed. So there is a option, especially with digital pilots, around having a timestamp associated with a health passport. In Chile, for example, there's a 3-month one and one of the tests, so that at least if there's a higher degree of certainty that a person seems to exhibit some sort of immunity for a 3-month period, that in itself may be worthwhile exploring and using. So there are also discussions around what an effective policy could look like. And naturally, the first phase and the most important thing is to have accurate and reliable testing. And that needs to come first, so that any program is essentially runs off the back of that. And this is as a first step. Secondly, more clarity around the length and duration, longevity of the seeming immunity. And as 4 months passes, we have some certainty over the 4-month period. And as I mentioned, as more time goes, that will become more clear as to how long immunity does last and whether it is in fact indefinite or not. And lastly, for it to be available and accessible, affordable for wide use, because there are potential consequences and things to bear in mind in this kind of program, which ought to be discussed, debated, and that's why it's so good to have this panel on today. And as my final slide, I'm going to touch upon that a little bit before we go on to some questions. So these are some of the recommendations and thoughts that were shared in the Ada Lovelace Institute. The report is called Exit Through the App Store, and that was just released on the 20th of April. So this is a capture from there, and it's well worth reading if you haven't done so already. And this last slide is also from the same report, and it's crucially the things that tend to come up a lot when there's a discussion around health passports. And I'm just drawing them out here so that hopefully we can talk about them some more in the panel. The first being that there are considerations around restrictions of individual rights, and particularly privacy. So a mitigation is around it being proportionate. So around some options include any organization, again, should this health passport program proceed in any of the countries that is experimenting with it, the one scenario would be any organization would have the ability to check a person's health status. But it doesn't have to be that way. There can be another scenario where a centralized authority in a country, such as the government or the health service, stipulates that only certain organizations have the rights to know your health status, such as only at airports, for example, only as you enter a care center or in a hospital, for example. There's naturally questions around stigmatization and discrimination, hence quite possibly regulation may be needed. Again, you could envisage where should an employer have the ability to assess whether someone seems to have this health passport and therefore suggest that they have immunity and others don't, they may require that and stipulate that that is needed in order for them to work. And so there are other wider considerations around ensuring that doesn't happen. It could even be ordering food to come to your home may be predicated on this, or restaurants only accepting those with this. And therefore, there are all these considerations that are become important, as well as the risk of there being a two-tier society, which has been sort of discussed. And any program like this, should it proceed, ought to be widely accessible and have everyone who wishes to participate, so that there's no risk of there being a two-tier society, especially because all the discussions rightfully suggest that the poor would naturally struggle the most, should they be even at a worse state or even more disadvantaged by not being part of the program. Naturally, there's already a risk associated with the trade-off that more and more people have now, unfortunately, having to make. One is around economic poverty, and do I go back to work because I need to sort of put food on the table? And secondly, I feel unwell. If I go out, I may risk sort of infecting others, and therefore, which risk do I take? And that's not in a good position for anyone to be in, nor is it needed or necessary. So these are the factors that need to be considered. Another is fraud and abuse. An example being, if someone has a health license, then being able to share that or swap that with someone else. So that has to be robust in the sense that you can't trade a health passport should a program like that come about. And equally the last point around perverse incentives. So if you don't have the virus, would there be a scenario where you are incentivized to get one just so that you can go back to work, or vice versa? And these are all the things that have been listed in the reports, and that are not just important, but technology can play a role in resolving. Naturally, technology can only play part of a role. Many of these considerations rely on regulation and other factors that are also important to bear in mind. If I were to just finish with how it could be done effectively, you could imagine that there are a group of population, group A, who, let's say, is 10% of the population, and they seem to have had the virus in the past and have now recovered from it. So they could, in theory, have a health passport and present that as they need to enter a care home, for example. And then you have group B, 90% of the population, who don't have any sort of health passport, and they don't have any immunity to this. So we could potentially all be better off if there's a program that's run effectively to help that group A effectively signal the fact that they have a proof of immunity, meaning that if there's full lockdown and there's a self-isolation, then everyone should be staying at home, and no one can therefore visit a care home. Whereas if the 10% who pose a very low risk, given that they've already recovered and they seem to have antibodies, if they're able to effectively prove that fact at the reception as they want to enter a care home, either to be a care worker or as a visitor, then the 90% who don't have this immunity yet, they're no worse off, because under a full lockdown, they wouldn't gain access to the care home anyway. And in fact, if a person in group B who has not had the virus yet, but is in an elderly and sort of vulnerable position, even they are better off knowing that a care worker has come to help them, but a care worker who has had some sort of proof of immunity. So once a program is able to be run effectively, then there are all these potential benefits that can come from them. And on a final note around trying all the different programs and technologies in order to mitigate and move towards getting life back to normal as fast as possible. On the vaccine side, there are a whole host of trials and a growing number of them, which is wonderful. And some are even getting close to production even before tests are finalized. Well, on the technology side, perhaps we should be doing the same, running very small controlled programs and pilots to see and iron out if a good, effective solution can come of it, so that we can be better prepared in the long term. Because naturally, the hope is that this will end as soon as possible, but we don't know if this is 3 months, 6 months, or even a 3-year pandemic, potentially longer. And as a result, health passports offer an option that is in exploration stage now and should be thought of as a consideration. And with that, I shall wrap up.
Thank you, Husayn, for that. Very interesting. To hear about like the development of health passports being in line with also, the race, or I guess the current need to find a vaccine. So thanks for bringing this to light. So without further ado, I'd like to welcome award-winning journalist Jennifer Schenker, the founder and chief editor of The Innovator, a global subscription newsletter about the digital transformation of business. So Jennifer will be welcoming the next panelists, also including Husayn. And so, over to you, Jennifer. Thank you.
Thank you. Thank you so much. So, yes, I'd like to ask Husayn, who just gave us a wonderful overview of what his company is doing, to join, and also introduce panelist Micha Benoliel, who is the co-founder and CEO of Nodle and a founding partner in the Coalition, a privacy-first contact tracing app that he will be telling us more about. And finally, Karan, Arora, the Chief Commercial Digital Officer at Astra Zeneca. They're working with the UK government to remotely monitor COVID-19 patients. So we're going to get three different perspectives on how to safely monitor patients or people. But let's start with you, Husayn, since you just gave us this great overview of what your company is doing. And you did highlight some of the logistical and ethical concerns with introducing this kind of immunity passport. We run the risk of having immunity haves, immunity have-nots, and there is this danger that the system could be corrupted or abused. Now, you ended your talk by saying perhaps we should do some trials or some controls to see how all of this could work. I believe your company might already be in talks or setting up some sort of a trial with hotels in Miami. Can you tell us a little bit about that and how it might work?
Yeah, absolutely. So your point around there being a risk in that some would have immunity and others not, that very much already is the case. We already have a group, and we can just guess, let's say it's 10% of the UK population, for instance, who seem to have immunity, and then we've got 90% who don't. The challenge really is the 10% being able to effectively signal that versus should there be no system for that signaling. And there are a number of different use cases and pilots that are being run at different levels. Some are government-based, quite a few are private sector. And an example, the hotel one that you mentioned, so this is for a hotel chain in the US where guests can opt to go and have a test and then bind that test to an app, who are our partners, and we bind the person's identity to that app. And then as they enter the hotel, they would be seen as a premium customer if they seem to have this sort of health license as part of the app versus not. And if they do, and if they can demonstrate that they seem to have immunity, they can access the sort of spa and gym where social distancing isn't an option. And so instead of those facilities being shut, they are now open, but only accessible to those few guests who have this presentable proof of immunity.
Is there not a danger that hotels might, only admit people who have this, and kind of leave everybody else aside? There
could be, absolutely. There is. So this is a 4 or 5 star hotel chain, and it's mostly, I suppose, the health facilities are shut as standard, but by having a small proportion of guests that can demonstrate this, they can open it for a small group, and everyone else can sort of go and do the other activities. So as hard as that may be, it's not, no one's going to sort of lose sleep over it. But the danger is you can have let's say a warehouse employer, and that employs warehouse staff, and the warehouse employer can say, no, only those who have some sort of presentable proof of immunity are able to come and work today, and the rest of you can't. And that's the situation which would be a risky one. And so therefore, both regulation and also having more government authorities and others across the world becoming involved is necessary, because for better or worse, unfortunately, well, way before COVID, we had a pretty much a two-tier system anyway with the economically deprived. This has exacerbated that, and private sector companies are running pilots. So the question becomes, would society as a whole be better off? Should there be a more central authority at a high level that can regulate and run it effectively?
Interesting. So where is the UK government? I mean, I think you're in talks with them.
So we, as well as many other companies, we submit, of what is public, we submitted evidence to the Science and Technology Committee established by the UK Parliament around how this could work. And that is sort of what is publicly shared.
Okay, thank you. So let me move now to you, Micha, because you've been working. The coalition has been working with the French government on coming up with a safe way and to do contact tracing in France. You are working on a privacy first approach. And you're also in talks with the Senegalese government. So one thing I wanted to clarify is the French government has released a system called Stop COVID. About 1 million people have already signed up for it. Is this using only part of the technology, and are you introducing something separate, an alternative system to that? Can you just clarify your involvement in the French government system, and then what else you're doing?
Absolutely, and thank you for having me today, Jennifer. So let me maybe tell you a little bit of the history of the company, Nodle, the team, how we came about contact tracing. So basically, we are a team of technologists. We are based mainly in San Francisco, but we have people in Asia, actually in the UK, also in London, and in France. So when we saw what was happening with contact tracing, and mainly what was happening in Singapore, we realized that we were one of the few teams in the world that would be very compelled to bring a solution that would protect people's privacy. My team and I in the past built a system using Bluetooth that was widely adopted with more than 10 million people using it, which was a messaging app you probably heard about. It's called FireChat, and it was used by the students in Hong Kong to organize their protest, the umbrella movement back in 2014. So we have a long time history in building systems on mobile that actually protect people's privacy and that use the Bluetooth interface. So we built the Coalition app, and we pushed that into a nonprofit called the Coalition Network. So the app code is open sourced, and indeed, as you indicated, we were actually helping the French government for the Stop COVID mobile application. So far, we help them mainly on the Bluetooth part because we have a long time expertise in that, and we recommended also some architecture for the contact tracing solution that would be more decentralized than the one they are currently using. But I think it's a question of time. I think things are going to evolve. Actually, the INRIA, who is the French research institute that coordinated this effort for the contact tracing app, has also been working on solutions and ideas to decentralize more the architecture. And the latest version of the Coalition app protocol is actually inspired from these ideas, and to improve the protocol of contact tracing and to make it more private. So we partnered with the French government. We are providing our solution for the Senegalese government. So they're going to be using our contact tracing protocol, which is called Whisper Tracing Protocol. And it's a fully decentralized protocol. It's great for privacy. It also enables governments to have some kind of information like the number of people who get alerted, the number of people who are infected, and all that while preserving people's privacy. We announced the Coalition app with the city of Berkeley in the US, and now we just shipped a week ago the new version. You can actually install it in the UK. If you go on the Play Store and type Coalition app, you will be able to go through the app and see how it works. The code is open source, like I mentioned. And it also has been reviewed by peers from diverse universities like MIT, Oxford, USC, and Stanford. And it's a great alternative, we believe, to the solution from Google and Apple, for example, which is in its first iteration inspired actually from the first version of our protocol. But we believe there are still a lot of improvement that are possible to actually make this even more private and secure for people. What I can say is we believe in a global coalition. We believe that to do a good job at contact tracing, and if we all want to be traveling again normally, or almost normally, we will need a solution that can work in different countries. And for that, you need cooperation. And our protocol is very well suited for enabling this interoperability between countries. We also see a lot of demand from the enterprise world because enterprise want to protect their employees, want to protect their workers. And that's why we also came up with a hardware solution that would work even when workers don't have any smartphone on them. So it's been a long journey. The team has been working around the clock in the last 2.5 months. We believe it's only the beginning. And we believe contact tracing is an amazing solution to actually protect people from the COVID-19, from a potential second wave of COVID-19, but also from any future pandemic. Like imagine if everyone had adopted contact tracing before this pandemic, we would have probably avoided this quarantine. We would have avoided this dramatic effect on the economy. And I think it's a habit that people need to take. It's going to take a little bit of time for people to understand that their privacy can be protected thanks to the new modern cryptography systems. It's something that is complex sometimes to grasp. But I think it has a great future ahead of us. And I think we can prevent actually this catastrophe that's happened globally to happen again with these kind of tools. It's also necessary because when you look at the number of tests that would be necessary just in the UK today to do a great job. I mean, the UK, I think, is a population of almost 70 million people. You would need to do a perfect job to test 5 to 6 million people a day. And that's a huge number. But if you couple this with, you would probably need to do like more than 50 million tests a day. But if you couple that with contact tracing efforts, manual and digital, then you can go down probably to 5-7 million tests a day, which is more realistic.
So I think what's really interesting here is that one of the reasons why we haven't had contact tracing is not the limitations of the technology, but questions of trust. And there are certain people who don't trust government, and there are others who do not trust private companies. And you are presenting an alternative as a nonprofit organization and a global one. But we'll come back to that. I'd like to move now to Karan and talk about how new technology approaches like blockchain or federated AI or edge computing are also helping move things forward and enabling safe remote monitoring of patients without breaching privacy.
Yeah, thank you, Jennifer. And perhaps I'll borrow a little bit from Husayn and Micha's discussion. Really good concepts and technology that's available to us now. I think first and foremost, it always starts with the use case of what you're trying to do. And Husayn's talk initially was very interesting because fundamentally the use cases, you just want to know yes or no, and everything else is sort of irrelevant and no more details are required. So I think your question around where does federated AI or blockchain or edge fit in really have to start with this question of what is it you're trying to solve and what is the data that you require to get to that answer. And even in the case of, I think Micha was talking about, using sort of almost like a collaboration of sort in terms of, having non-federated expansion of this technology. Your barrier is not going to be tech and contact tracing. And I think unfortunately the barrier is going to be policy and trust. And also the use cases are quite intriguing because one issue, if you just talk about COVID and we continue on the discussion we were having, is identifying who has the antibody and who's at risk. The second issue you're going to try to solve for is how do I then help this person which then gets a little bit into what we're doing with the NHS, which is around remote monitoring of patients. And when you come to that, then actually using technologies like blockchain don't work, because in that case, you do need to know specifically who the patient is. How do you get that, patient-specific data back to the HCP to intervene, then to manage? And then the technologies, perhaps more like edge computing, makes sense, where you have data on protected firewalls that are accessible to only specific individuals. And then you have a third use case where actually you're trying to manage not only remote management and care of those patients beyond just the contact tracing, but you're also trying to get into insights around populations and trending around comorbidities and disease. Like one of the things with COVID that we found is chronic patients are probably at highest risk of getting COVID. And also they're at highest risk because now they're not going into hospital. So the amount of death has risen with patients that are, have heart failure or diabetes or cancer patients. And so then when you're trying to draw these population insights, then you have to get into sort of a mix between having, non-personalized patient data being disclosed to having de-identified population data sets that you can actually mine to get, higher level algorithms and risk stratification models put in place to manage cohorts of population. So, and it's a long answer to your question, but I think essentially the reason I went through those three scenarios is each technology is going to vary for those three scenarios, and they're probably all three of these technologies, whether it's the cryptography that we were talking about, or blockchain, to having edge computing, to federated AI, all of those things will have to work sort of together to make sure that those use cases are mobilized.
So let me ask you a follow-up question, Karan, and I'll ask the other two panelists to jump in. So, the technology is there, right? But you talked about how the other factors are really holding things back. Mm-hmm. The whole healthcare industry is moving to one where you want to focus on outcomes rather than products, personalized medicine, and also management of chronic diseases. All of these things require remote monitoring, and that requires trust. So let me ask, in Europe, is the emphasis on the way that Europe has approached privacy, is it enabling innovation, or do you feel like it's putting the brake on innovation?
Yeah, no, it's a great question. So I think Europe in general, and I think both Micha and Husayn will have their perspective views on this. But I think looking at it from a global standpoint, we work with institutions in the US and European Union and outside. Europe has been pre-COVID probably being the most restrictive in terms of driving innovation in this space, where you're dealing with specific patient-related data in healthcare. And I was recalling a conversation we had with digital ministers, in Belgium, and one of the things in the forum that we talked about was how policy has to shift and become more trusting from a regulatory standpoint in order for innovation to not get stifled in the in the European Union. Whereas in the US, you will find technologies, and more so even in Asia, where they have gone quite a ways further in terms of leveraging digital to manage healthcare and thereby reduce burden. So I think now in a post-COVID setting, Europe is catching up. I've seen a lot of shifts in policy. Just recently, Germany put in policies in terms of digital health reimbursement. That's going to drive innovation. You're going to see the NHS is changing their views in terms of how they use remote monitoring. It's becoming a standard of care for primary care patients. So I don't think that's going to be a limitation anymore. I do think trust is going to be a continued limitation. So I think the policies will catch up post-COVID, but winning trust of patients on how the data is used, how it's shared, is going to be very important. And I think the challenge for technology companies is data always has been sort of this black box in many ways. It's like we gather the data, but patients or individuals never really knew what was the use of the data and how was it used. I think transparency is going to be sort of the next wave, being very clear to the patients in a very simple language, not the traditional sort of the user agreements that you go through that are like 6-point font, in terms of how their data is being utilized and what's the benefit of that data use to them. And I think that'll help drive further more innovation.
Well, we have the technology, and we have the data. Now we just have to figure out how to leverage it properly.
Yeah.
And I think, Micha, I think you have some strong views on how Europe has been approaching privacy.
Well, I think Europe has done that always with very good intent. I'm going to take this to more like a macro view on, I think, on innovation globally, not necessarily just focused on telemedicine or health. But I think today we have techniques of cryptography that are very hard to understand. And I'm not sure that the Europe, and especially the people who do these laws, actually have that deep understanding of what can be done. And I'm going to give you a choice, like a simple question with two questions, and you're going to tell me which one you actually prefer. So imagine a scenario where you can enable a user basically to remove any of their private information that is held by a company or an organization at any time. And that's basically the principles of GDPR. But what if you can create a service that basically uses technique of modern cryptography, where you can basically provide the same service, have the same level of integrity when you talk to someone or provide a service, but you never need or have any need to identify or hold any private information from that person. I mean, if I had the choice, and when it comes to health, and more specifically under the skin health, I would personally opt for a solution where basically I'm never giving up any of my private information to any third party. And I'm sure in here, many people will probably think like me. So I think Europe has a very good intent, but I think it's still backwards on where we are, the level we are with technology and cryptography. And I think there's a lot to be done there.
Okay, Husayn, would you like to add anything to that?
So you mentioned some don't trust big tech, others don't trust big governments. I don't trust either, right? And it's a difficult position to be in because it's usually times like these where either the legislative changes or consumer rights are usually reduced in such periods. And the challenge becomes exactly like Micha said, there are now technologies, including cryptography and others, which means that a person's personal information does not need to be shared with anyone else. So that's in part our approach, where once a person's been verified, no private company or government has access to any of the personal information. They just have a yes, no on the person's status and are they who they claim to be. Now, naturally, there is a difference and a distinction to be made in that most individuals trust the health authorities, and there are brands that are or agencies that are trusted. So in the UK, we have the National Health Service. They already have all your health data, right? And that's not much as of an issue or area of concern. The challenge becomes, as you have scenarios where many private businesses may need access to that, how that is orchestrated and how that is done in a proper way. And I actually see Europe ahead of other jurisdictions, not behind, in that they have tried to balance consumer protection with innovation, and that is slower, right? No one's questioning that you can move faster in China. But the problem you have in China is zero privacy, with all the risks that come with that. So this, in fact, could be a good opportunity for us to reassess how do we get all the benefits of shareable digital data, including health, and especially health, but without having to give up on our privacy and other rights. And the good news is that technology can enable it.
Yeah, I think I'd love to get your views on whether there is this larger opportunity here for Europe to create a kind of third way, an alternative to the tech giants in the US who basically have no government oversight and do whatever they want with people's personal data, and the Chinese government that uses its data, its access to data to kind of control the population. So do we have this larger opportunity in Europe, not just for health applications, but in general, to give people control over their personal data in a way that's safe and acceptable to everyone? And so it would solve not just the health issues, but allow people to do a lot of other things with their data in a trusted environment. Micha, do you want to respond to that?
Well, I think well, what's very important in any of these services, there should be basically a very explicit reason why people should sign in when they are asked to sign in and provide their identity. I think what we achieved with actually the contact tracing solutions is we don't require the user to ever sign in. Basically, we can do this work very efficiently without having any identity revealed by the user, because it's all systems of randomization and preserving people's anonymity. And it's the same, actually. We started to introduce test results, and we made it in a way where basically you could have what I call the anonymous health results, where you can have the results provided inside your app without you having to, at any moment, having disclosed your identity. And I think that should be a choice of the user.
Anybody want to take it? We're almost out of time, but anyone want to take a guess on how long it might be before we have systems in place that make people feel comfortable enough to share their data?
I just want to introduce something. Maybe we could actually, by providing incentivization models, reward users when they share the data, so they can, at the same time, it's a good way to educate them so they can understand the value there is for someone to actually, any organization to have access to that private information. It's going to be a lot of education. It's going to take time before, I think, behaviors change. So, but incentivization may accelerate that.
I'm a little more pessimistic. I mean, to Micha's view, I think incentives definitely will help move certain sectors and use cases faster for adoption. But I think at scale, it's still going to take a while. I mean, I think, the example that Husayn gave for leisure and entertainment perhaps is a perfect use case, because, we already had, people, being in sort of loyalty programs versus not, right? It's like an equivalent of another loyalty program where you have the passport to get access. So I think you will see adoption there faster than in healthcare. Healthcare is going to be a little bit more tricky, I think.
Okay, thank you. I think we're out of time, but please join us for the Q&A that will start in about 15 minutes from now.
Want access to more CogX videos? Subscribe now for free at cogx.co.